Welcome to Immigrant Bazaar podcast, a weekly podcast where we talk about topics that matter to immigrants living in this country. We bring guests that can share their knowledge and expertise in the subject. Your hosts for today's show are myself, Bahram.
And Anwar here.
Okay, great. And for today's topic, we're talking about preserving behavioral health. And we're going to relate to more how to preserve behavioral health and talk about mental health, substance abuse, anything related for immigrants, and how to help them out. And for today's subject, we have a guest, and his name is Saad. Saad has extensive healthcare background, and he has expertise in behavioral health as well. So Saad, welcome to the show. We hope you're gonna have you're gonna enjoy your time.
Thank you very much.
And please, you're welcome. Please introduce yourself, Saad. Give us a little knowledge, information about yourself. Thank you.
Sure. So again, thank you very much for having me, Bahram and Anwar. It's really an honor and privilege to be here and discussing some of the information that I can share, right, with the team or with the audience that are out there. And I call everyone a team, right? They're all part of our team. Had it been Americans or had it been immigrants. So at the end of the day, it's really all about how we're going to make our lives and other people's life better, right? That's really the goal. So the idea here is I have been in US. I'm an immigrant myself, first generation, came July 1st, 2000. And I was 18 years old and very kind of naive, not knowing the world out there. Parents just pushed us out and said, okay, you finish your high school, go out in the world and, learn more. Simple as that. So we came here, struggled quite a bit like any other immigrant, finished my undergrad, went to a university in Newark and JIT, did my undergrad and then also did my graduation, my master's degree. Primarily, bachelor's was in biomedical engineering. I always had that thing in me, primarily from the family, to become a doctor. But because of the med schools being very expensive here and being an international student, it was almost impossible for me to get into it. So I ended up doing biomedical engineering and master's in science management with biomedical and IT background. Mm-hmm. So what that helped me do at the end of the day, it helped me to get my H1, right? Like anyone else. We needed a job and we needed an H1. So I got my H1 business visa and I started working as healthcare analyst. First job was actually before I even got to it, I did a scientist work, one of the large pharmaceutical companies, and then didn't get my H1 through them. And then ended up getting into financial healthcare for one of the largest healthcare industry in New York. Worked there for 5 years, got my green card, all that good stuff. And yes, for a Pakistani background and Saudi born, the immigration was a little easier because there's not a lot of wait period and my green card was done within 2 years. So 2 to 3 years. And then I got my green card, and then eventually I shifted to another healthcare industry, working as an analyst. Now I am in a leadership role within the same healthcare organization, and primarily do a lot of strategic partnerships, works, and implementations in the product arena. So, when you talk about Medicaid products or the apps or making other people's life easier, how to use certain products, that's where I come in and I own some of those products.
Yeah, I wanted to actually step back and ask Saad, officially or through dictionary definitions, what is behavioral health? How do we define it, first of all?
Right. So I don't know if it's a dictionary definition, but at the end of the day, the thing that I learned, which I still think a lot of people don't know it, even in the healthcare world. It's basically two main categories, right? When you talk about behavioral health, right? One is mental health, and then the other portion of it is substance use disorder. Just wanted to caution that most recently it's been advised to use substance use disorder, not substance abuse. The word abuse is not really user friendly. A lot of people still use abuse, and that's really why I'm just saying there's a lot of education around that as well. So substance use disorder and mental health, those are the two main categories that initially when I joined, I had to kind of delineate myself as well and say, okay, those are the two areas. And as you're doing an intervention, you're doing an intervention in those two particular areas. And those could be connected, and they could be connected on the medical side as well. So just wanted to make sure that the audience understand that those are the two major categories that we would be focusing on as well.
Okay. And so specifically talking about, let's talk about first, mental health, I guess, right? So mental health, talking about mental health, what is mental health? So basically it's an anxiety, right? Can be mental health, depression could be mental health issues. Those are the things that, I was reading the facts the other day. I think for teenagers, right? I mean, for youth from age of 6 through 17, I believe the statistics was more than around 30% or something. They never get treated at all. They may realize they have, or their parents may realize they have it, but they may never get properly treated. They may never be able to kind of say, okay, well, look, this person needs, treatment, this person needs help, but they cannot get it. And, what happens as a result of that? As a result of that, you're going to have, if you go to school, you're going to have poor performance, right? Academically, you're not going to be doing well, you're going to have problems with, if you finish school, getting, into university, even, or, if it keeps going to college, and after college, getting into job, all those. So those are important kind of factors in terms of making sure that our children and children of immigrants who come here are properly, as a parent, or as people who surrounding them, understand that if the kid is struggling through things that they may not be, especially if they come just if they come to US, from different culture, they may not be adapting to US, assimilating to US, in terms of education, in terms of getting used to new environment, and depending on if the environment is immigrant friendly, meaning if they're in other different cultures, or if it's only like one type of race over there. So those things kind of matter from mental health. But at the same time, again, the other part you mentioned was substance use disorder, right? That's the right word, right terminology to use. With that, I mean, what's going on with the world, right? It's a vaping thing, is right? Is one of the things that's happening lately, right? That can be considered as part of substance use, correct? Vaping and drugs, getting addicted to type of addictions, I believe, right? Is that what they include?
Right. So so let me just take a little bit of a step back, and sort of explain from the mental health perspective, as you have mentioned, Bahram, and then I'll get into the substance use as well. So some of the facts, right, that we need to understand is that one, as you mentioned on the top of the discussion, that 1 in 5 people, right, have a mental health issue, right? Now, most of them do not get help, right? Why? That's a question that I think we all need to understand, especially the immigrant population as well, right? And let alone American population as well. The statistics, as we're reading through, and I think I'm going through Brain and Behavioral website, and one of the confirmation or the topics that they're looking at, or at least focusing on at the moment, is the type of mental health issues are primarily, right? You're looking into anxiety, you're looking into depression, bipolar disorder, and schizophrenia, right? Those are the top 4 that you're looking into. Now, just from statistics perspective, 18% of Americans, right, they have an anxiety disorder. These numbers are
18%.
huge.
18% from the entire population.
Correct. And as we're going through again, I'm referring to one of the websites where the statistics has been done, right? And 7% of Americans have depression. Now that leaves you with 2.6% Americans having a bipolar disorder, and 1% having a schizophrenia. Obviously, those are the more complicated mental health issues. Now, if you think about it, when they say 18%, now they're also applying that by saying 1 in 5 Americans have, these type of mental health issues. So they're important. They don't get help or the necessary help that you need, for the reasons being, number one, stigma. There's a huge stigma in the community here, and I'm going to also attach that to substance use disorder when the time comes later in our discussion. Right now in the mental health, same problem. People are not comfortable talking about it because they've been judged about it. And there are other factors that play with that. And especially if you're coming from an immigrant community and you happen to have family members that are living in the nearby town or what have you, this is supposed to be a hush hush. You can't talk about it. Right?
Yeah, it's one of the things I wanted to ask. Like you're saying in America, there's a stigma. I'm thinking of other more traditional cultures, traditional societies, like in Pakistan, Tajikistan, or I don't know, China, even a lot of Asian countries are very traditional. It will be even a bigger stigma, right? So
absolutely. People don't want to talk about it.
That percentage could be. So you think that percentage could be even higher?
It could be higher. And you got to also understand what happens is these are the reported data, right? You may not even have a reported in those more traditional countries, and people may not even consider some of these as a problem. Anxiety, who even treats about it? Who even talks about anxiety over there, right? Oh, you'll get over it. Let's move on, right? A lot of times that kind of discussion happens. And I personally have known people in the families, and they just don't want to talk about it. I mean, I want to also say, I know we're 3 here, right? Typically when I do some presentations and I go to an audience, by the raise of hands, I say, how many of you actually know someone who has a behavioral health need, either you or your friend's friend, but you have known them? People don't understand that. But at the end of the call, almost every single person raises his hand, because now they're educated, knowing it's a mental health or substance use. It could be your cousin, it could be a cousin's cousin. At the end of the day, you may know someone who are struggling with these conditions. And the reason I'm using a word condition is very deliberate, especially when it comes to substance use disorder world, because the goal here is to treat it as a condition, just like diabetes, just like heart condition. Especially when you're in mental health or substance use disorder, a lot of times people say, oh, you have control over it. You don't. And you have to understand that this is a condition. It requires proper attention and medical intervention, which a lot of times, as you can see, the statistic shows, they don't take help because it's perceived as if you can just figure it out yourself. Let's not talk about it. And so one of the other interesting facts, and Bahram, you talked about it really briefly, was there's a myth, right, that says children and teens do not experience mental illness, right? That's a myth out there. Now, the fact is, research shows that 1 in 5 teenagers have or will have a mental illness. 1 in 5. Now, in 50% of adults who have a mental health issue, the first signs showed up before the age of 14. The first signs that show up is before the age of 14. So if you are concerned with your child or about your child, early intervention is the best way to tackle it. Now, had it be an immigrant population or had it be an American population, it's a very common thing. So think about it again, 50% of the people who have been diagnosed, out of those, they're saying the first signs that they showed was at the age of 14. So you're a teenager at that time.
So really, by the time your kid finishes elementary school, around that age, you already need to be in watch, just to make sure that your kid is kind of his behavior, his attitude, his performance in school, and his social life, his not just academic, is all like going as, I don't want to use the word expected because there's nothing called expected, but as normal as you can believe, right? Because for everybody is different, I mean, every kid, like, we have kids, everybody has kids, every kid grows differently. Some kids are quiet, some kids are not, some kids are introvert, some kids are extrovert. But again, you just have to be mindful, especially you come to this country, that so that, you know, like you're saying, statistically, by the time they're 14, it's gonna show up. So you need to kind of be understanding, oh, if is my son, is my daughter, showing some symptoms that I think I need to kind of step up and kind of, look for some medical, intervention, right?
And that's the key, right? Step up. Because if you're seeing it and you don't react to it, because most of us think, oh, it's something that'll be probably with the age, or they're acting and reacting as part of this age and they'll get over it. There could be certain things like that, but there could be certain things that really requires an intervention. And be mindful, be educated, and having that issue, it's okay, they're treatable, right? But not talking about it causes more damage.
That's correct.
Yeah, actually, I think Bahram touched a very important point. So you also mentioned, like, when you have these trainings, people realize that, hey, they actually do know people who have mental health issues. So I wanted to find out, what are the clearest signs, because there's one, again, repeating Bahram, some people are extraordinary in a certain way. They're very active, some kids or some adults. Some of them are just quiet, and you say, that's the character, that's the personality. But how do you distinguish that from being a sign of mental health issue? Like, what are the boundaries? What are the signs that we should be looking at for?
Yeah, honestly, I'm not a medical expert in certain areas, but I don't want to be passing any judgment on that. But I would, here's my 2 cents on this though, right? When you talk about anxiety, when you talk about depression, there are certain important factors you have to keep it. Those are the main, for example, we're looking into, right? If someone is having an anxiety attacks, right? You know what anxiety would be. You're having heart palpitations. You're not really performing to the best of your ability based on some anxiety factors that are coming in. Depression, if you are stuck in a room, you're not coming out. You don't want to talk about certain topics. And I'm sure there's more symptoms and more avenues that you can look into, and you can search as well and take the medical help. But I just want to make sure one thing that people understands, right? They need to also be open with their doctors. At the end of the day, when you're showing some sort of symptoms, that's where you need to talk, right? And the best advice could be given is by your doctors. And I'm going to touch upon that topic in a minute, because there's another avenue that is not, there's a constraint in US, and that we're facing very, from the doctor perspective as well. I'll talk about it in a minute. But yeah, I mean, you're the best judge of your child. You know what they're going through. You're with them 24/7. And typically people knows when you're going through an anxiety or when you're going through a phase of depression. For example, now COVID-19 pandemic, perfect example, right? I've known so many people who officially now came out and said, yes, we are in depression. Why? We're stuck in a room, or we're stuck in one house, right? Same problem can happen with your children, right? Because they could be very extrovert. They could be going out playing every day. Now you're stuck in the house for months, and you're not going to schools. You're not talking to your friends. What are you doing? You're staying home all day, right? You can't even go out on a vacation. You cannot do anything. So what is that causing? Causing anxiety. It's causing a depression for people in some cases. If you look at the statistical data, the depression and anxiety behavioral health hotline calls have been increasing for the same reasons. A lot of times what's happening is working parents, especially moms, right? If they have to balance the work and take the calls and do the work from home and take care of the children, because schools are now remote for the most part, it's a very, very difficult balancing act. And moms and fathers are calling because of depression, because of anxiety that's causing, because the work is work. They have to finish their work as well. So a lot of workplace may be understanding that, and some of them may not be understanding that. So people at the end of the day have deliverables due that they need to to get it done, and now you're juggling multiple work items, and it's and then a lot of people here who have their parents secluded for months. I've known personally someone who texted me the other day and said she has not met her elderly mom for now, I think 7 months. The only thing she can do is elderly mom. She can only do is she go to her mom's site where she is, ask the mom to come out in the balcony and wave at her so she can see from distance that she's okay, and then she leaves.
Wow. Yeah. Tough.
These are all very good symptoms of anxiety and depression, right? And we just have to be mindful. Now, I don't exactly know what can happen, right? But these are all the symptoms that can lead up to them being officially diagnosed.
Yeah, kind of a segue here. We had recently elections, and other than the presidential elections, there was also some states that had voting on marijuana laws. And I was checking the news the other day, and it seems like almost every state, there's just a couple, there are beyond medical use of marijuana. So there's some states that allow, there are other states that allow recreational use. So it really, boggles my mind that, how do we draw the distinction of that use and abuse? Where is use? What is abuse here? The country is changing, and I'm an immigrant here, and I'm trying to, set boundaries for myself, first of all, as a person, because, I need to have, I would like to have a certain standard for myself, that I don't go into that rabbit hole, but also my family. So if people are getting depressed and they ask to vote, hey, you want marijuana to be legalized? Everyone voted yes, it seems. So these things seem to be going hand in hand. What do you think about that?
Right. Yeah. I mean, definitely. So that's a nice segue into substance use disorder, arena. There is definitely a recreational purpose that a lot of people are also using it for, and there are medicinal purpose as well, that it's been used for. And I know that people, I don't know what's the percentage was, but at the end of the day, it seems like that it got voted for. So we're looking into that now. I don't know what the ramifications will be at the end of the day. We obviously have to sit back and see what the legislatures and the lawmakers kind of put, if there are any guardrails, for lack of a better word, that they can put forth on that. So before we get into that topic of substance use, just want to remind everyone and the viewers on one very main important topic related to mental health. One of the idea that people need to understand also, I did some survey with our panelists on our one of the largest healthcare panelists that we typically work with. And I had asked them, if I give you a health assessment related to mental health, primarily anxiety, depressions, would you use it? Or have you used it before? So we can see where do you stand on the pendulum of, on the equilibrium of whether you are worded well or you actually have a condition. And a lot of people said that they have used in the past the assessments. However, they haven't done anything about it if they were diagnosed or if they were told that they have a condition. And the follow-up question was sometimes why, right? And a lot of people actually are saying that they are also concerned about their data being misused, especially when it's on the web. And that's really very important to mention because of that stigma again coming into play. People need to understand that if the source is legit, meaning if you're going to secure sites and those sites are having good, guardrails and balances and security features, please feel free to use those assessments. Please feel free to tell your provider the results of those assessments, and please feel free
Follow up, basically. Yeah.
to follow up on that, because if you really need help, that's why the purpose of those assessments are, right? I may not know all the symptoms, but the assessments questions asks you those questions, and if you answer them certain way, you may need a help, and don't shy away from it. So I just want to make sure I made that point. Now, coming to the discussion of substance use disorder, right? It's, again, I have very astonishing. I've done a lot of presentations on that, on the work of substance use disorder, and some of the statistics, again, which I love to talk about. 57% growth in opioid deaths from 2010 to 2015. Some of that data is still like a few years old because the national data takes time to be compiled. So 57% growth in opioid deaths. Okay, and now I'm talking, this is nationally. Now, the primary cause of death, heroin and fentanyl. That's a synthetic opioid, fentanyl. It's a killer. A small dosage of that could make it into overdose, and people don't know that. Now, less than 1 in 10 people with a substance use disorder receive a treatment. Less than 1 in 10. So again, the problem of stigma comes into play here. Now, the ones that do get treatment, right? Less than 30% of the people who do get treatment actually ends up getting only the evidence-based treatment. So only that 30% people gets an evidence-based treatment. The rest of them just gets treated. The reason being
30% of 1/10. So it's actually
exactly
3% of the total.
Exactly. The reason being
and what is the
again,
success rate of those?
Yeah, I mean, it's really unfortunate.
It's not going to be 100%. Yeah.
Right, and success is a very subjective term in this world, right? Because you could be clean and then one bad incident, and and the remission and all that kind of thing. But the idea, what I was trying to explain here, is that evidence-based treatment. Why? Because when you go to your regular primary care provider, he may not be or she may not be the best doctor to treat you on the subject of behavioral health. Because you have psychiatrists and psychologists who should be treating you, but that field is sort of in a drought phase right now in US primarily. And if a person goes to your behavioral health providers, no one is connecting them back to your PCP, the primary care. So a lot of times when the treatments are happening with the behavioral health providers, your primary care don't even know what type of medications you're on because no one closed the loop with them. So if your primary care is supposed to be a lot of, and I'm going to throw a word here called value-based models. In New Jersey and nationally, there are a lot of models that health insurance companies are putting forth called value-based. They're shifting the paradigm from going fee for service to fee for quality. So they're trying to make a more quality programs on the medical side. But what that means is your primary care doctors are on the hook for you, for your health care. And if they're on the hook for your health care and your total cost of care and your medication interactions and things of all the other, and if they are out of loop and they don't know what your medications, what your total health looks like, well, guess what? They can't really treat you well because they don't have the 360 view of your health. So that's really very important. And that's one of the constraints that a lot of health insurance companies, there's a lot of software tools that are introduced. They're trying to work towards bridging that gap. We're still far behind, but companies are making strides as long as they understand that there's need and there's a problem.
So the one thing as you mentioned, the importance of health insurance companies, or just I guess healthcare system itself to work well in order to for the mental health outcomes to be successful, right? So I mean in general from the point where the the disease is, I mean, the condition is the word, right? Condition is properly diagnosed, and you start going to treatment and start getting treated. Consistently going through following up. Like you said, value-based following up, not just for the sake of it, but making sure your PCP, your doctors, right? I mean, primary care, your doctors, and your follow-up visits to specialists, everything is taken care of. One of the things is important in this case, especially for immigrants, is making sure you have health insurance, right? So importance of having proper health insurance. So I was reading the other fact was, in general, in this country, for the in general mental health, right? Mental health, 11% of people who have those conditions don't have any kind of insurance. No, they don't have any insurance at all. Forget about those. They may have insurance, but they don't use it because of stigma and all the things you mentioned earlier, because of cultural norms and things. But some people don't even have insurance. So, in my opinion, especially for immigrants out there who are listening, who are watching, if you don't have health insurance, and not necessarily just for mental, because just mentioning here as part of this conversation is, if you don't have health insurance, there's ways to get health insurance, and we're gonna have separate conversations. I don't want to talk about too much here, because we're gonna have an episode how to get your proper insurance, whether it's through the government. There's out there Medicaid programs, Medicare programs for senior citizens, and for those who work, based on your income eligibility things. There's the federal exchange programs, state exchange, where you can, depending, you plug in your information, you plug in your income, you plug in your information, and they will be able to give you very affordable insurance. So you should be able, if you have a child, or if you have, yourself, if you have your spouse who are not doing well, have some, mental health issues, or even, specific substance issues or things, you need to be able to treat. And for the way to get treated is to have proper insurance. In this country, without insurance, things are very expensive, and you want to make sure you have health insurance and you are eligible. As long as you're legal in this country, you came legally here, through work, through, lottery, through any marriage, anything, you need to be able to get health insurance, and you should get health insurance, and it's available. So please take advantage of that. It's important, especially dealing with this issue, like Saad is explaining really well about, addictions and abuse. You meant addictions and substance use disorder problems.
Right. And then you also got to understand, hopefully the Obamacare is here. If that gets repealed, that's a different story. But today, it's mandated, right? You got to have health insurance if you're legal. So why paying the penalty when you may want to pay a little bit more and get an insurance and get benefit, right? So that's an important factor that we need to keep.
Good point, yes.
And then just on the same topic of substance use, some of the other statistics that are astonishing, always blows my mind every time I look at it, and I've done it a million times by now. One of the White House document that was published, and that's again 2015, it says that there's 45 times increase in the cost to combat opioid crisis. And what I mean by that, from 2001, the cost was 11.5 billion. 2015, 504 billion. All right.
Half a trillion.
So think about from that perspective, and that's why I think in 2016 or 17, maybe it was 17 or 18, I forgot the year, it was actually called a national crisis by the White House, and they had a whole task force on that. The reason being is, in every state, there has issues related to the substance use disorder, primarily opioid overdose. And since we are in New Jersey, and if you focus on just hone on New Jersey is no different, right? Just like any other state, we're having issues here as well. And I think I was reading, I think it's nj.com, one of the websites here. I think going back to June of this year, just alone in New Jersey, the opioid overdose deaths are 10 per day. And I'm talking about deaths per day. I'm not talking about the people that overdose and you save life. I'm talking about the deaths that are happening that are 10 per day on that same narrative from 2014 to 2016 in 2 years. There is a drug called Narcan. That drug reverses the opioid overdoses. and the health paramedics or the emergency officials, they're allowed to use that. And they have used that drug, the opioid reversal drug, 18,000 times in between 2014 to 2016. So these are all astonishing figures, and it all shows that there is an issue. The issue is persistent. It's increasing day by day. There's a lot of interventions that the insurance, the health professionals are putting forth. It's not like that they're sitting. And we're starting to see that tip as well. So there's definitely, I know we put forth a lot of initiatives to help users combat that issue. But the problem is we have to make an awareness. We have to tell people what the issue is, talk about that issue, understand that it is an issue, understand that substance use is a condition. It's not a choice. Once you're hooked onto it, there are, addiction withdrawal symptoms that comes in, and those are very nasty. I mean, think about it. I don't know, for immigrant population, I'm a Muslim, and I do Ramadan and I do fasting, and I'm an avid drinker of coffee. I drink coffee daily, maybe 2-3 times a day. But the day of Ramadan, the first day of fasting, I go through headaches.
You get withdrawals?
Everyone goes through, most of my friends go through headache. Why? It's a caffeine withdrawal symptoms. So if a person is hooked onto drugs, think of those withdrawal symptoms being multiplied multiple times.
Yeah, it's really a scary subject that I think a lot of immigrants would want to protect themselves and their families from this opioid crisis. And what do you think are the best measures? So, hanging out with the right people, I guess, but you can't always control everything. And from one side, you want to adapt to the life here as an immigrant, but in certain ways, you don't want to assimilate too much. And it's a very serious, I think, issue. A lot of immigrants struggle with the balancing of adaptation and assimilation.
Right.
And when it comes to these substances, so you might have your cultural or religious prohibitions that kind of protect you from that, but if you don't have those, what would be your suggestions of how to protect yourself?
Yeah, I mean, I get involved directly, and I'm not a therapist by any means, or I'm not certified in that, but I have some knowledge in that world. I get involved in one shape or form within the community, right? Especially now, if I'm going to talk about Muslim community, obviously the issue exists there too. The imams and the things, and they communicate and they talk to us. So the problem here is, again, number one, so anything, if you work on to form a solution for any problem, the number one thing base is you have to acknowledge that there is a problem. Yeah. If you don't acknowledge that you have a problem, then what are we solving for? Yeah. It's the same exact thing with the people who have an SUD, substance use disorder, or MH, mental health. If you don't acknowledge that you have a problem, you're not going to strive to make it better. And it all depends on that person as well. We can give you all the tools to be successful, but if you're not going to implement those tools in your daily life, you're not going to be successful. No one's going to be able to make it better for you unless and until you decide by yourself you want to come out of that situation. Is it going to be difficult? Yes. But is it doable? Absolutely. Right? You have support systems here. You have rehab centers, right? Number one factor here in America is social determinants. That's the number one factor. You would know a lot of people in the country, who are homeless. Yeah. Because why? They were on drugs. We have heard a lot of personal stories around it. And now they don't have cars, they don't have phones, they don't have house, they don't have clothes, they don't have food. But you're telling them, get out of it. Well, how can they get out of
Oh,
it if you're not going to help me do all those social determinants? So there are helps now. Insurance providers and other Medicaid areas, they're working towards that as well, helping people on the social determinants. And there are companies, I'm going to name one, there's a lot more. Eva's Village, for example, in Patterson. I had personally went there, and it's an amazing place. They have buildings that they put forth, and they give housing, affordable housing. They educate people. They actually give them skill sets to cope and then go out in the world and work. And they have success stories there too.
so it's basically a rehab center sort of thing, rehab facility.
It's a rehab, it's and they have full program, whatever I don't have the full details, but but the point is that they advocate the same thing, right? Are you ready to move on? Right? If you're ready, we're here to help you, right? That's the message that we're trying to, and and it's a very sensitive topic, right? Especially for parents.
Yes.
If their kids are in that situation, in some cases, parents have sold everything, and and they're in hopes that their son or their daughter will come out of it, right? It's very heartbreaking at the same time. So we want to make sure that we are appreciative, and we understand that we're sensitive to people's feelings as well, and that's why we're saying we that's an issue that we understand can happen, and it may happen. We need to understand that there are support systems around it, acknowledge it, and let's take out the stigma out of this factor, and let's be the ambassadors of this, right? Let's not judge people. Think about it. One thing, if the stigma not only stays here, it also propagates to your providers. Think about it for a second. Would you be waiting in a waiting room if you have a person who's a drug addict also being waiting in that same room to see a doctor? How would you look at that person? That's the stigma we're talking about. A lot of providers don't want that, right? Because they're saying, oh, there are other people sitting in the same room. I don't feel comfortable. However, that's a stigma because they're humans. That's out of their control at this point. We're here to help them come out of it. So those are a lot of factors that I think people needs to understand and acknowledge that it can happen to anyone. And let's not treat them differently. Let's try to help them uplift and get them out of the situation.
So what about let's talk about proactive measures. How to we understand that if we talked about symptoms, and we talked about signs, and we talked about things we can do kind of to work that out. What about some proactive measures, right? So for example, NIH made the National Institute of Health, right, did the research. They had this research, and they took sample of immigrants from I guess from Florida, I guess it was. And it was a high school, they picked high school kids, they did the study of high school kids, Hispanic high school kids that were born here, raised here, versus first generation immigrants, right? Versus Hispanic high school kids that came here relatively recently, let's say, 4 or 5 years, and they're in high school, right? So, I mean, they may speak English because, in high school, you pick up English fast. So, as they get assimilated to the country, as they get used to the environment in terms of school, they did the research found out that those kids who actually came here recently, they are more able to stand up against addictions, stand up against vaping, having less issues related to vaping, like e-cigarettes. What's going on with high schools, e-cigarettes, like 27 or 28% of this country's high school students, use e-cigarettes, normally, and it's becoming part of normal. So the point of what I'm trying to say, I guess, here is, as people come here from versus people who were born here, those who come here bring the culture, bring the norms with them, as not even first generation, as those immigrants that just come here, their parents have instilled in them the sense of culture, the sense of responsibility, so that they know what is right, what is wrong, what is they should go wherever they should not step in, where they know these guys are good guys I can hang out with. It does not mean you have to be segregated. It does not mean you have to say, okay, no, I'm not going to hang out. No, you clearly you have to get adopted, because it's important to be, adaptation is important in this country, right? You want to do well in school, you need to be able to communicate. You cannot be just otherwise you can have, like you were saying, symptoms of anxiety and depression by sitting alone and being so the point here is, make sure that, I guess, all those immigrants who come here, who are just coming here, or just the parents who are just bringing their children to high school, it's important to make sure whatever the religion you practice, right, or whatever the norms, cultures you have, continue to practice it at home. Work with the children. Do not let them hang out outside just on their own. Oh yeah, they're going to be fine, they're going to get used to it because they know English. No, it's not like that. Studies show if you have this proper culture, if you preserve your culture, preserve your religion, whatever religion you believe, right? Preserve your norms that you have in terms of, understanding what is right, what is wrong, what is good, what is bad. That's going to help. And those are facts. It's not like, somebody's kind of preaching just their theory. It's a science that they show that indeed is important. So if you want to do really well for your, help out your kids, make sure you take care of them by keeping your culture, keeping your religion, work with them, and constant communication. Like we were saying earlier, no stigmatism here. Make sure you talk well, you have clear discussions. That was just something that I guess, what do you think? What else do you think is important in terms of proactively taking care of those things?
Yeah, no, these are all great points, and I 100% agree. So someone actually, I was listening to some video the other day, and someone said, oh, America's like a melting pot where everyone sort of kind of blends in, right? From culture perspective. And someone corrected them and said, no, it's not a melting pot. America is like a salad bowl where you have different ingredients, but every ingredient retains its own identity, right? So to your point, integration is that, right? You're going to retain your own identity, whether you're Muslim, whether you're Christian, whether you're Sikh, Hindu, Jew, whatever religion you belong to, and you're an immigrant, you're coming here, that's fine. You can retain that. You can integrate that. But the number one factor is really, at the end of the day, open lines of communications, right? My son, for example, I tell him we don't drink beer, we don't drink alcohol, we don't consume alcohol. By the way, no one talks about alcohol as badly as opioid. Listen, it's not equally bad, right? But it's just not lucrative because a lot of people consumes it. It's I don't have the statistics in front of me, but there's a huge number where people die because of alcohol overdose. Okay, yeah. So same. So letting our kids know what's right, what's wrong, in some cases will help. That's number one. And open lines of communication. Assuming that they know it, it doesn't help. Assuming that you told them one time does not help. It's a constant regurgitation of that communication, right? And when I say constant, it doesn't mean every day, but on a frequent interval basis, when you get an opportunity, when you think there's a right time, you talk to your kids about it and you tell them that, listen, kid, or listen, daughter, there are, ramifications of that. And that's one of the reasons why, because I've mentioned 1 in 5 kids, 50% of adults who end up having a mental health, most of them, 50% of them showed early signs when? Age of 14. So the 6th graders, the 8th graders, and the high school kids, that's your early intervention. And had it be your mental health or had it be your substance use? So that's one of the reasons why large healthcare organizations, they started to tackle that at a high school and a middle school level. They're having plays potentially that talks about the ramifications of the drugs. They're bringing awareness to the kids. A lot of times kids do it for amusement, but they don't understand it can cause addiction. One of the statistics I was reading was really, really astonishing, that I think it says 80%, I could be wrong there, 70 or 80% of people who end up being a substance use addict are the ones that are naive users. And what I mean by that, they did not know that they're going to get addicted. And they just happen to get addicted. And how do you happen to get addicted? I give you my example. I had an ACL surgery. My knee surgery happened back in 2016. It was I was playing soccer and that happened. And that's a very common sports injury. However, what happens is when the surgery happens, I was given almost a month medication of oxycodone, and that's an opioid.
Yeah.
Because
Very
of the pain.
famous oxycodone. Yeah.
Right. And what happens is, I knew it because I'm in that field. I wouldn't use it unless I really need to. But if you have a person who says, oh, doctor prescribes me this maybe once a day or whatever, it'll help me. Well, guess what? You did it for 30 days.
Yeah.
And next thing you know, you got hooked onto it. A lot of people I know of actually go to people's houses and they go directly to medicine cabinets. Why? They're looking for that. So we got to understand that thing, that people don't know what they don't know. And that's really what the awareness is about, right? If you are getting a surgery, especially one other thing, tooth, dentist, everyone goes to dentist. You may have a root canal. You may pull your teeth out. There's pain. To manage that pain, they give you those opioids. So you need to make sure that, this is us, right? Make sure awareness is there. Make sure that those medications can cause you addiction. You have to be very careful as to when to use it, right? And once you're done, please, please, please dispose the medications. There's a lot of bins, pharmacies, they'll tell you, Walgreens has it. You need to dispose those medications. Don't keep them in the house. Because if your kids use it, anyone else use it, they can get hooked onto it. And the data shows 70 to 80% people are naive users. So the data doesn't lie. That's what we're trying to explain here, is so people needs to understand that component. And so that's one thing, right? As Bahram mentioned, create awareness, let people know the medications I just mentioned. Then obviously intervention. Don't think it's something that, a lot of times now in New Jersey, I know large health insurance are working through other providers, and they're trying to bring in something called medication assisted treatment, MAT. What they used to do, doctors before, they didn't really know, especially the PCPs, because they're not behavioral health providers. They would just give you medication and that's it, but no therapy. So you need a combination of both to be better, right? A lot of times in depression world, I was reading the statistics that I think 60 or 70% people who gets a depression medication, that may not work for them because there are multiple medications. Everyone person is different. And sometimes it takes little time for the medications to kick in. So what happens is then there's an adherence. People don't go to that medication and say, well, it doesn't work for me, I'm not going to take it. So awareness around that. Sometimes the medication, it may take a few weeks or so to kick in to work through your system. And if it does not work, please talk to your doctor. There may be other medications that would work for you, but they help. Not taking it is not going to help you, right? So, and then also from that world, there are a lot of this is us making awareness, making sure that the people understand, and making sure people are themselves engaging it. There's a telehealth now with the COVID being so high. A lot of doctors are available on the phone now. You can do it at home, right? Do your therapies at home. And it helps. I've had friends, personal friends, they are going through difficult times, and first we had to convince them to do the therapy, especially their spouses. Again, immigrant mentality. Oh no, she's fine or he's fine. No, they don't need it. No, that exists. The health insurance companies have a dedicated line for suicidal 24/7. And they get calls because people have suicidal thoughts. This is all real. So convincing them, and then they took the therapy, and that person, I spoke to them now, how are you feeling? Amazing. Simple coping mechanisms, they tell you. Simple. They tell you tools. They work with you. There are tools that are out there, and apps that are out there that can help you. But it's always good if you have a structured, evidence-based treatment, because then they know what they're dealing with, and they're the experts.
that's that's great suggestion, Saad. I think in this episode we talked about generally just to probably give a little summary of this. We talked about understanding what's behavioral health, and you spoke about mental health, and importance of the frequency of people, adults and kids that get diagnosed with mental health or even substance use disorder issues. We talked about as immigrants, what can we do, trying to look for signs, symptoms of those, and removing stigmatism, understanding the importance of acknowledging the problem exists and what do we do to solve them, importance of having health insurance, importance of making sure that keeping your open line communication, preserving your culture, your religious beliefs, your values that you have as part of your national ethnicity, whatever you're coming from. Those help to cope, those help to identify, those help to solve your problems, whether you're having anxiety, depression, some kind of drug abuse, any drug use disorders, anything else. So I think we have captured what we wanted to capture. Anwar, do you have any other thoughts?
Yeah, I actually, just looking at the components, like sub-bullets for this behavioral health, I mean, I can think of a couple of other that, well, a lot of them actually deserve separate episodes probably, because you can talk a lot about each one of these. With teenagers, there's the problem of video gaming, sometimes going way overboard of what is practical, kids spending entire nights, and that's not any substance, but it's a game. So there's a lot of things, I think, with one episode, there's no way to cover all of that. But I think this was a very good introduction, at the very least. And I want to thank Saad for such a thoughtful, very insightful presentation of the data and what's out there, and the main issues of putting stigma on these things. And I think for immigrant community, that's a number one issue, like not acknowledging the problem, not thinking that this is out of control of that person, because from traditional societies, most of immigrants are from traditional societies. That's a main issue, I think. So in that sense, I think this was very, very useful. Thanks a lot, Saad.
Yeah, no problem.
I appreciate your participation today.
Yeah, my closing comment would be that if it's a great summary, Bahram. Just one thing, if people get out of this podcast or this discussion, one thing that they should take out is the mental health or behavioral health, let's just put it this way, is a condition. All right. Think of it as a condition, just like diabetes, just like heart conditions. Those are treatable, but it may not go away, right? It may not be curable. It may be, right, in some cases, but they are treatable, and you need treatment and intervention. And acknowledging that as a condition is going to really help you move forward in life.
Yeah, thank you, Saad. I think you nailed it. Indeed. We want to make sure that our listeners and users understand that, and as Anwar was mentioning, actually, in future, if people like the episode, people provide any comments, we may actually have future separate segments of what we've discussed in detail. Like Anwar was mentioning, like I like that he mentioned the fact about people getting addicted to video gaming, especially kids who come to US and the parents are working and things happening, what they do, they have to, nowadays with the COVID era, everybody's at home. What do? You just play a whole day in video game, and that becomes addiction, and it is certainly one way or another. People may become introverts and not talk to others and get into some other. So that's a separate discussion. I don't want to talk about more now, but Saad, we appreciate your time here today. It was really great. And for our listeners, please do subscribe to us. We have our Facebook page, we have YouTube page, we have our Instagram. And wherever you're listening to our podcast, whether it's Apple Podcasts, Spotify, anywhere else you're listening to podcasts, please subscribe, give us your comments, like. And we need we need your help to expand this channel. We need your help to make sure this channel is being watched and listened, whichever way is comfortable for them, by many people, because we want our goal from this episode, from different, there's different subject we talk here in this podcast, to make sure that people take some benefit from this. Today's topic was great, and Saad made a great reference at the end that people have some kind of takeaway. So that's our goal, and we want to make sure that this indeed helps everyone.
All right.
Yeah, comment, send emails to immigrant@gmail.com, immigrantbazaar@gmail.com. Comment, feel free to subscribe, and wait for future episodes. Thanks a lot, Saad.
Thank you so
Thank
much.
you.